I hope everyone has some really great summer plans. This is the first summer actually that we are not inundated with weddings and bachelorette parties and showers. So I am looking forward to just hanging out. Let's see. Hi, I think I see the commissioner just joining. Good morning.
Good morning. Apologies for being a couple minutes late.
No worries at all. I was just filibustering.
Excellent. Thought there might still be people joining. I had a slight reboot issue with my computer, but I'm here now, so good.
I feel like that's the theme of the week, Commissioner.
Although we're having a little summer today, I'm very happy about that before we have our 10th rainy weekend.
Love that.
New England. Okay, everyone's putting their name and affiliation in the chat by way of introduction. And just a reminder, if we are going to add information to chat, to do it to everyone, not just panelists, right?
Yep.
Okay, great. Let me know when you think we're ready to roll.
I do think that we're pretty good. A lot of people messaged me earlier this week that they were unfortunately not going to be able to make it. So we're going to be working a little bit with a little bit lesser crew today. So, it's that time of year. A lot of
Absolutely.
graduations and
Yes.
family and, but we are recording. So I will send all members this recording after the meeting.
We also ended the 9:30 call a few minutes late with the
Oh.
MAF team and Tufts. It was great.
Oh, I'm so glad they were there. That's great. Okay, well, good morning, everyone. We have a good, strong agenda today. We are going to talk a little bit about where we are on the 26th budget process. And we will then talk a little bit about the Commonwealth Cares for Children program. We are gearing up for FY26 program changes, some required by statute and some informed by the sort of evolution and continued movement of this program from COVID era stabilization to ongoing operational supports for programs with our unique state's commitment to the C3 program. And then many of you are aware that the department is statutorily or legally required to do a 5-year strategic plan. We've been operating from one that ends at the ends of this fiscal year. It has had durability, although it, like everything else, got COVID disrupted. And so we have an opportunity now looking forward for FY20 or calendar year 26 through 2030 to think a little bit about our strategic planning efforts. And we are starting that process. We've been talking about it with the board and internally, and we're kind of kicking it off externally a little bit with all of you today. Mostly focused on sort of our plans for how to approach that, which when we get to that, we can talk about it a little bit more. But we have so much work underway, as do all of you. And I think our intention is really to deepen and further the work that's currently underway rather than do a big new blue sky strategic planning process. We have so many things going right in the early education and care system right now. And I think it's our intention in partnership with all of you to continue that momentum and progress. And again, deepen and further many of the initiatives that we already have underway. So we'll talk a little bit about our approach to that and get your feedback about how that sits with all of you. I don't have a lot of updates, but we do have a board meeting next week. We're going to be at the Walker School in Needham, and I am very excited that we're going to have an opportunity to share the work that's been going on over the last year about revising our residential program regulations. It's not something we talk a lot about here, but an incredibly important priority for the agency and for many agencies across state government. The residential world is a little bit different than the way we interact with the childcare world, where we are all things. Regulators, we are teacher qualifications and soon to be credentialers. We are funders, we are conveners, in the residential space, we're really the licensors, and we work in partnership with many of the other state agencies. But the licensing, like in childcare, provides the foundation for the quality of the programs. Those regulations have not been substantially revised since 2005. In fact, I think it says Office for Children, even not even just OCCS in some parts of those 84 pages of regulation. So we're looking forward to that work and being at our partners at Walker School, who are both one of our residential programs, but also our early childhood mental health grantee for the Boston area. So we will be talking about the C3 program, a version of what we're going to be presenting to you all today, as well as the residential reg revision. So looking forward to that meeting, and also to the last meeting of the board for this fiscal year, where we'll take the summer off. My only other real update is just, I'm really looking forward this afternoon. I'm going to be going to the Amplify Latinx conference, which is happening at WGBH. Have an opportunity to meet with a lot of Latino businesses, employers, and advocates, and a lot of family child care providers and programs that are going to be participating. But the really exciting thing is I'll be fortunate enough to be on a fireside chat panel with Governor Healy. And the focus is really on childcare and early education as an economic infrastructure investment, and a multi-generation wealth building strategy. Something we have all worked so hard for a long time to make sure people recognized around early education and childcare, and the educators that work in our field. So excited to be part of that panel this afternoon and to lift up that work. So with that, I think, is Chris on? Is he doing the budget? Sorry. Do you want me to do the budget? All right, I'm going to do the budget. Addison, go on to the next slide, please. Okay, well, let's pull up the agenda, which I just walked through, just to make sure everyone saw that. And then I will walk through where we are on the budget. Okay, so Addison, the view is a little small. No, there we go. Okay, I don't have to tell all of you budget experts out there that the budget process is long and has multi-steps in it, starting with the governor in January when she releases what's called House 1 in the first year of the legislative session. The House completed their budget activities in April. The Senate just completed their budget in May, and we are awaiting the naming of a conference committee between the House and the Senate when they will discuss differences between the versions of their budget and come to consensus on a final budget that they will send to the governor, and with a July 1 start. So just a quick reminder of some of the investments that the governor included in her House 1 budget, really doubling down and leaning into our Gateway to Pre-K agenda. So continued investments in our Commonwealth Preschool Partnership Initiative. And we have been on, you may have seen a roadshow around the CPPI program around the state. We started in Somerville, we were in Northampton, and then last week we were in Worcester. Framingham, we'll see you soon, Heidi. We're coming out to Framingham shortly, but Monday we'll be in Sandwich. So it's been incredibly exciting to see the work that's happening out with the Commonwealth Preschool Partnership Initiative. And if we weren't already deeply committed to growing the state's commitment to universal preschool through this program, these visits have really reinforced that more families are accessing services than ever before. There is an incredible community of leadership happening around this program in the communities that are planning and implementing, where early childhood programs and the public schools are coming together to talk about the experience of early childhood education consistently across the community. And probably almost most excitingly, the delivery of special education services and behavioral health supports in a collaborative model in truly the least restrictive setting. So really excited to share some of the findings from that roadshow with everyone. As I said, the governor's commitment to really using this program as our vehicle to supporting universally accessible preschool through our incredible thriving mixed delivery system. supporting the thriving of it. Speaking of, we also, the governor made significant investments in the Child Care Financial Assistance Program to ensure that we can continue to serve the nearly 65,000 families that are currently being served. That's about a 10,000 child increase over when the governor came into office, both for DCF and DTA families, as well as our income eligible families, and sustaining the Commonwealth's commitment to the C3 program as we continue to make that more a permanent part of our funding structure and programming. Okay. I think I kind of hit on these. So many additional kind of continued investments, whether it's through our Head Start and Early Head Start supplemental program, our CFCE programs, early childhood mental health included in the governor's House One budget. Just noting, and I'm sure we'll talk about it a little bit this afternoon, but $5 million for Career Pathways, which is a reduction to that program and has been part of our statewide discussions about making sure that the free community college efforts really align with our Career Pathways, and that is work that is underway. Just quick highlights for the House and Senate. There are differences among these versions that have pretty significant implications for the agency and will be part of the conference committee. There are differences in the caseload account. The Senate budget matches the House One number, which is the number we believe is necessary to maintain access to services, and projected increases, at least for DTA and DCF. Both the House One number and the Senate number, we don't believe at this point would allow us to reopen access to the waiting list, but it would allow us to maintain services for all families. Again, C3, not a conferenceable number. Big differences around the CPPI program between the House and the Senate and the governor's version. As I said, this administration is really committed to trying to move that program and continue the progress we've made. And then differences, obviously, in both versions, including in the EEC administrative line item, which is something that we're watching very carefully to ensure that we can continue to support the infrastructure that we have built, both the human capital as well as the IT programs that we are investing in over the next several years. Okay. Not going to go through the line items, but here it is for you if you want to see how the differences line up. But the last thing I just wanted to mention is that the governor also filed a fair share supplemental. So you can go to the next slide. So the governor filed with her budget an FY25 fair share supplemental budget, which is from the surplus revenues from the so-called millionaires tax. And these are sort of one-time funds that are available through surplus funding. And the governor, you can see on the left-hand side, included quite a large amount of flexible dollars for the agency that could be used for workforce, affordability and access, for continuing to invest in quality, and also support some of the implementation of recommendations coming out of the Early Education and Care Task Force. 150 million, that would be 50 for our CPPI program over 3 years, and then 100 million that would provide a level of flexibility across the array of levers and investments that we've been making. You can see the House and Senate both took their approach slightly differently. The House included a number of investments that align in some ways with their own fingerprints towards the House One proposal, and the Senate did include some sort of smaller line item earmarks for individual child care programs. So as the conference committee undertakes its work, there'll definitely be discussions between the House and the Senate versions of this fair share supplemental, which is unusual. So you have the just sort of General Appropriations Act budget being proposed, and then a side supplemental budget, which would increase funding in certain areas based on which version actually comes out. Okay.
Amy, sorry to interrupt. Can
Yeah,
you, we've gotten a few questions about, because there's actually the 3 vehicles moving, because the SUP for FY25. So I just wanted to highlight that because we've been packaging the FY26 state budget and the supplemental that that the governor filed around the surtax as one advocacy action, and then we know there was another kind of closeout SUP for FY25. that has
Yeah,
happened.
it is a complicated number of
It is.
vehicles that are moving. So let me just walk through that really quick. Addison, can you just stop sharing for a second in case unless there's a specific slide people want to look at, so we can all look at each other. I suspect there's going to be a couple questions. Yes, so there were 3 vehicles that were generally, so the governor filed her budget, so her House 1 budget, which is for FY26, which starts on July 1st, and that was primarily what I ran through. When she filed that, she also filed the Fair Share supplemental, which is completely funded by surplus from the Fair Share or millionaires tax. And then in order for, as I mentioned, we're serving more families than we ever had before. And so in order to make sure that we could end the budget year in the black at EEC, the governor also filed an FY25, so that's this current year that ends June 30th, supplemental budget. And I should have started with that because it's the big headline, which is the governor filed that in April. And we are so grateful for everything that all of you did and our legislative partners, because that passed, was it last week or maybe even the end of the week before last week, which will allow us to make sure that we end the year paying all of our providers of childcare financial assistance on time. So we are incredibly grateful for the legislative commitment here, all of your communication to your legislative colleagues and others around the state. And that budget was supplemental budget was passed by the legislature. They actually pulled out early education and care, our funding from a larger supplemental budget, and I think that had a lot to do with all the communication that you had with your legislators, letting them know how important this was to our community and to the economy, that we were able to pay all these providers of early education and care. So we are feel really, really fortunate and really recognized in many ways by the highest up by legislators across the Commonwealth, and certainly the leadership level as well. So really, really grateful for those actions, and hoping that support for the governor's House 1 level of funding will not put us in a position like this next year. That is the absolute goal. Chris, were you going to jump in? He's to fix something I might have gotten wrong.
No, just to add, and so that folks are aware, we do have messages going out both through our family access and engagement team to all of our subsidy administrators and our R&R partners and our contracted providers. And I believe a message went out last night, if I remember right, looking at Emily for a nod. Yep. Last night through LEAD to programs to let them know just the status update that the stuff passed. And I think I saw a question in the chat around April payments. Yeah, Kim saying, Kim Davenport, payments are moving forward. Our team was very quick to start working to make sure we get those payments out the door. So as always, if anyone sort of encounters an issue, our fiscal team is there to let us know. So please do, but we are moving as quickly as we can to get those payments out the door.
So those of you following the very specific details of it is all the voucher payments that are going to be made. It is the cost reimbursement administrative contracts for our contracted providers, and is the retroactive payments for our family child care rate increases that we had been holding in anticipation of action on the supplemental budget. We are catching up with the things we owed, and we aren't going to be late on what would have been our typical June 10th payment. Helen.
Good morning. So
good morning.
Question. You put up the slide with the governor's fair share of 150 million, and then the Senate and the House as a separate. Was that in addition to or instead of what the governor was proposing?
That was instead of, so those were those versions. So on that slide includes what the governor included just on early ed, because there's other things in that fair share stuff, by the way, for transportation, higher education, K-12. So what you saw there was what the governor included in her version of that 25 supplemental surplus fair share budget, and then what the House included in theirs and what the Senate included in there. So pretty big differences between among the three versions.
Okay, thank you. That's what I was trying to understand.
Yeah, it's a complicated budget year, although in some ways a little less complicated than last year was really complicated too. a lot of language changes and other things last year. So other questions on the budget, or Amy, other things you've been hearing on the 9:30 call that we can clarify here?
No, I think it's just been the budget. And I think it's, it's been like experience, folks. Like even when we were writing our messages, we kind of confirmed with Victoria and Mass taxpayers because we just want to make sure we're getting it right.
Yeah, so many different moving parts. So we're very happy to have the FY25 caseload SUP behind us so that we can focus on the fair share SUP and the FY26 budget now. Okay.
Thank you.
Nothing else on budget, Madison?
I think we have one hand raised.
Oh, sorry, Kim, go ahead.
Good morning, thank you. I had one, I'll call it budget adjacent issue, and you can say we're going to get to it later or, punt it, I'm perfectly fine. But as we're talking money, one of the concerns that have been bubbling up from providers here in the Central Mass area is the concern over the reconciliation at the training, I think, for cost reimbursement. Reconciliation is towards the end of June. Like we're crushing in on the end of the year, and there is a lot of worry about that process and making sure it goes smoothly. And there's just, I'm raising the concern bell because folks have said that the training's been pushed off several times, and now we're like 10 days before the end of the actual fiscal year before we know what needs to be done. So I'm raising that as a general concern that I'm hoping you or your team members can speak to help the providers kind of feel like they can, partner and be in control of getting this all done and not panic.
I think that, so thank you for raising that. And I think we do understand that to be an area of concern, and have had a number of staff illnesses that have required those programs those trainings to be canceled. So I don't think we should talk about it here, but why don't we make sure that we have Addison and Chris an opportunity for providers who have concerns about that and are actively unclear about what should happen before the end of the fiscal year, have an opportunity to participate with the team.
Great. Thank you, Commissioner. Appreciate it.
Okay. Any other pressing issues out in the field that you want to make sure we raise before we jump over to Commonwealth Cares for Children? Okay, I am going to turn it over to Jocelyn to walk us through what's happening with C3.
Thank you very much, Commissioner. So as I think many of you know, we have been, spending the last few months reviewing the feedback that we've gotten from a number of sources over the course of the year on the current C3 formula, and considering the extent to which there are any changes that we should propose for FY26. And in going through this process, we're keeping in mind a few important points that you can see here on the slide. One is recognizing that there have been some significant changes to the formula over the past 2 years that, created some disruptions that, everybody has accommodated and adjusted to, but nonetheless, we don't want to continue that level of disruption for programs. And certainly have heard confirmation that there's general agreement in the field around that point as well. So we do remain committed to the predictability and also trying to make any changes we propose for 26 to be relatively small. So to that end, we're really thinking about, from the feedback that we're hearing, both like what might we do in 26, and then also what might be worth thinking about in a more long-term and planful way for 27. We also do have some statutory requirements that come into play in the next fiscal year. One is that we are required, per the language that was put into statute during the last year's budget process, starting in this fiscal year, to ensure that all programs receiving C3 demonstrate a willingness to enroll children receiving childcare financial assistance. And we also have the expectation that we begin the process of encouraging programs to meet salary benchmarks. So we have done some thinking about how to do this, and I will discuss that as we go. We've also heard that there are aspects of the equity adjustment that feel not quite equitable to programs. One is the way in which we address the calculation of a program's community opportunity index. So this is done at the census tract level, and we've heard from programs that are in a community that is generally considered a very low income community, but might have some variation from census tract to census tract in small ways. That, you know, they're across the street from an area that is a very low opportunity area, and they serve a lot of families from that area, but they're not counted and given the equity adjustment. And that is something that we do want to fix going into 26. We've also heard that for programs in tier 2, there's a very broad range of commitment to serving children with childcare financial assistance, from programs that have one child to those that are almost at the 25% benchmark that would get you into tier 1. So we're looking into how to make that more of a smooth adjustment and prorate the adjustment in that tier. And we're also continued to the sort of ongoing approach that we've always used to collect data and continue to understand the implications of field feedback and think about the ways in which the formula is functioning and not. Also just highlighting this very important point, it does, and you saw the budget, it does look like C3 will be level funded at 475 million, which means that any changes that we make in FY26 have to be cost neutral. There is no opportunity to add expenses to the program. We're talking about adjustments within the current funding that we have. Can you go to the next slide? And these are a reminder of the levers that we have. So we look at all of these in turn and think about how we're using them. We have eligibility requirements, fund use requirements, the formula, and then the ongoing data collection that we engage in. Go to the next slide. So in thinking about eligibility, the statutory language that we do have to comply with this coming fiscal year does affect eligibility. The language is here on the slide. I'm not going to read it. But this is the fact that programs do need to be willing to accept children with CCFA. And our proposed plan to address this is when we do update the application and the formula, we will include an attestation for all participating programs to attest that they are willing to do this. Currently, when we look at the information that we have about programs' current participation and willingness, 69% now do participate in CCFA by at least having an active voucher agreement or contracted slots. And of those that do not currently participate, when asked in the most recent survey, 83% of those not participating indicated that they are willing to or are undecided. But I think there's an openness and an undecided place to sort of adjust to expectations. So,
Jocelyn, can we ask a question?
Oh, sure.
I'm curious, of the people who said they have, the ability, do you know how many are actually serving kids?
It's not the full 69%. I think we're at about 60% who actually have children enrolled, but I would actually have to, I don't know, Ellen, if you have
60% of the 69% is what you're saying.
69% is, you might not have children enrolled to be part of that 69%, but you have a voucher agreement or you have a contract, and you are indicating through those means that you're willing to take a child if a child came to you.
But what you just said was
It's a
only
smaller
of
number
the
that actually
69,
have
only
children
60%
enrolled.
probably. Okay. All right. Sorry. I'm just trying to figure that out. Okay.
I don't remember the exact percentage with actual enrollment. Ellen, I don't know if you have that number or not, but we could certainly look it up.
Well, my only question is just a question, because it sounds like ultimately you'll have to redistribute the pie since there's no additional funding coming. I'm just curious. It's really nice that people have said they're willing to do it, but if they're actually not doing it, then
they would remain in tier 3.
Okay.
But can I just jump in, Jocelyn? I think I just want to be clear. You don't mean 60% of the 69%.
No. I think it
right, because it's much
60%
higher.
is not the right number. Let me just be
I
clear.
thought
But yeah, we are now at more than 50% of our programs serving children, actually having children enrolled.
Yes.
But of the programs as a whole, not just of the 69%. Yes. Percentages can be tricky if you're not watching the denominator. So in any case, we're looking into making this change in November when we are planning to update the application. But don't expect it to have a huge impact based on what we've seen so far and what programs are reporting when you look across the field as a whole. Go to the next slide. On the fund use side, we're proposing that we start to require that 50% of C3 funds actually be used to support the workforce. So we're talking about different forms of compensation and investments in the workforce. So we've interpreted this broadly. When we look at the current reports on fund use across the programs taking C3, the vast majority of programs are already doing this. So this didn't feel like it would be a significant change, but it does move us in the direction required by the legislature of highlighting the ways in which this is an investment in workforce and is meant to support those types of investments. Go to the next slide. So focusing in on the formula and where we're thinking about making adjustments. So as I mentioned, the formula adjustments that we're proposing for FY26 really focus in on the equity adjustments. So those are those 3 tiers that we have in place, where tier 1 gets the highest adjustment up, and those are programs that are serving significant number of children with CCFA or Head Start programs, or programs in very low community opportunity areas. We are addressing the question about, are there some programs that are in towns where they're predominantly very low COI, but that program itself might not be in the town, by identifying towns that are already predominantly very low COI as towns where anybody in that town would receive the tier 1 adjustment. We also have, we're sort of cautiously worked in FY25 to allow programs to report to us the non-CCFA scholarships that they provided, and for programs that serve more than 25% of their capacity through a non-CCFA scholarship that provides support for more than 50% of the program's tuition, those would be eligible to move into tier 1. And we're also, when we look at the programs in tier 2, considering both CCFA and non-CCFA scholarships together. So to date, we've considered those separately, and you have to meet one benchmark or the other. But now for programs in tier 2, if they do serve both, they have some children on CCFA and some children that are receiving a non-CCFA scholarship that's more than 50% of tuition, that would be an additive number. And then what we're proposing doing to the actual formula itself is there would be a prorated adjustment between a multiplier of 2 to 2.8. Currently, everybody in that tier gets a 2.5 adjustment, and there would be more of a range based on the percentage of licensed capacity served by children in this category. Helen?
Sorry, I'm just wondering, are there any public schools that access these funds?
No, public, it's only, the eligibility requirement
Public school,
restricts this
preschool.
to private funded or licensed programs.
And that's because?
That's been in place since the beginning of the grant, because other funds are available for district schools.
This is originally was federal childcare dollars. So coming from HHS, CCDF, and and was an ARPA era funding coming to the licensed childcare program, while many other funds went kind of to the public schools. So it is a source for our community-based programs that we've maintained that.
Okay, thank you.
Yeah, I mean, I will say as an aside, and this doesn't necessarily connect to the C3 conversation, but I think it's something that we've been hearing in our work with public schools, is that districts are now going through difficult periods with their budget at the moment. And we do hear that.
Exactly. I mean,
We do, and
scholarships.
with the CPPI funding as well. But I think the solve for that, I mean, I think we definitely need to be having a conversation about public school funding and early childhood and the young children that are being served, and how the funding streams should be maximized and work together.
Especially in places across the Commonwealth that don't have vouchers, towns and cities. There's some towns and cities that don't access them, and what can you do? Because there are children who are, would need financial assistance and can't participate.
Yep.
Thank you.
And I see that Patrick asked if we know the breakdown of early ed versus school age youth being served. We do have that number. I don't have it right off the top of my head, but we do collect enrollment information, and we also collect it by age from all of the programs. For FY27, we have just done work with a team from AIR to revise our cost models, which we use to set the current base rates a year or so ago. Now that we have revised models, we do plan to revisit those models and consider whether there are additional changes to the base rate or additional program types that we should be considering. And I'll get into some of the details of that in a few slides. We also have been developing a draft salary scale. We'll continue to work on the salary scale and also consider opportunities as the next step to being responsive to the requirement to include attention to a salary scale in C3, consider the opportunities to integrate that into the formula. Go to the next slide. And we will continue the data collection that we've been doing. At this point, we are in a cadence where the November application is a longer application. This is the point where we reset payments and make any changes and adjustments to the formula. Ideally, we would continue that again in November. I'll talk about the timeline of getting approval for our proposed changes, but November is our goal. And then the rest of the year, with the exception of May, the application is a far more reduced application where we're only collecting the information that we need to gather data for ongoing adjustment for the sort of future years adjustments, such as enrollment information monthly, so we can calculate an average annual enrollment. And then in May, we would have, again, recollect through a longer application, an update, so that, you know, again, when we're using a look back, for example, in the non-CCFA scholarships, we have information that reflects, is more reflective of what's happening across the year and not just based on one time point. We do also plan to continue the surveys, but, you know, not have them happen at the same time as the extended application. So we're looking at August and February for a biannual survey. Some of this information will be standard and consistent, like the fund use information that we've been collecting regularly. Some we will continue to include additional questions as topics need attention, but also are committed to keeping this as short as possible and only focusing on the most essential questions and data, and continue to use this information in a regular and ongoing way. Go to the next slide. So here's a timeline, and I think this gets into some of the details of the steps that we need to take to move from our proposal to bringing the formula into any changes into fruition. Right now, in May and June, we are in this process of sort of reviewing the information and are going to the board with these proposals in the June board meeting. We will need to put any changes out to public comment. We're hoping to be able to do that over the summer, but that does to some degree depend on the board's timeline in voting to put that out. In an ideal timeline, we would then be able to bring back revised changes to either the September or October board meeting for implementation, for vote and implementation in November. And go to the next slide. And then finally, in looking at a little bit more detail on what we're talking about in FY27, one thing that has come up that I hadn't talked about yet, but we did speak with the board about, is there is an adjustment for programs that are under enrolled. So if your reported enrollment is average annual enrollment is below your license capacity, C3 is prorated, but we do allow a buffer of 25%. So if you're at 75% of your capacity or above, you do get paid fully on your license capacity. And this is intentional on our part. We wanted to make sure that programs had the space to have, you know, children come in and out, to not have to be fully enrolled at all points in time per the formula, because we want there to be openings for children and families as they come and look for space. And we do also want to support programs in growing over time. What we found is that seems to be a reasonable buffer to give, particularly for center-based programs. That allows for seasonal variation. So for programs where the summer program, particularly out of school time programs, it's a different size than the regular school year program. There's flexibility in the license capacity to accommodate those shifts. And it does also allow programs to plan for growth and not have to, you know, sort of be too tight to their exact license capacity from month to month. As I mentioned, we do want to do some work with the new cost models that we have. First of all, just sort of revisiting everything that we've done to date and making sure that the current structure makes sense. But we also recognize and have heard from programs that there are some that make a significant investment in comprehensive services and program staff to better support children with special needs. And we do want to look at this particular program model in the cost work and consider the potential of a different rate for programs that meet the criteria of providing these types of services. And we'll have to figure out what that requirement would be, and also, sort of how we would account for that in the formula. And that will take us some time to do it. It's not something we can do quickly. Similarly, we've heard that there are ways in which the current cost model and formula don't really fully account for the different types of models that out of school time programs run. So we want to spend some time thinking about that particular issue. And we also recognize as we move into a space where we're starting to think very intentionally about how C3 can support compensation goals for educators, looking at how we are integrating that into our thinking about family childcare programs, because they don't, family childcare educators don't receive a salary. Their income is the revenue they get off of their program that they're running, and understanding how we both understand the income that family childcare educators are gaining and the relationship of revenue and expenses within those programs, to consider the extent to which C3 is supporting compensation for family childcare educators. That's also something that we want to put some time into understanding. And then we do need to think across all program types about where and how we might integrate in additional salary expectations, as per the legislative mandate to start moving in that direction. And Kate, I see your comment.
I'm happy to jump in if you want, Jocelyn, too.
Yeah,
here.
Kate's just highlighting that there have been inflationary increases that programs are facing, and yes, that has not been reflected in the allocation that we've gotten for C3 in the proposed budgets.
Well, yeah, and I think so. The program's been level funded at 475, which we are very grateful for. And there were big adjustments kind of to the formula last year, but this year we're not proposing, besides the ones that Jocelyn proposed, but we have projected in the ability to maintain funding at sort of the current levels, unless you're in that second tier where there might be some adjustments, and also allow new programs to come in. So one of the changes we made last year was to set monthly amounts instead of changing amounts every month. And that was for the purposes of budget planning. You could expect how much, programs could expect how much they would receive annually. We will be able to budget and project for that. And that has allowed us to plan for the potential for new programs to be able to come in. I mean, part of the goal of C3 is to continue to increase capacity. So we needed to make some space for additional programs. So we are going to maintain them only coming in on a quarterly basis. So obviously that will be subject to the availability of funds, but we do project that there will be some available for new programs coming in over the course of the year while maintaining funding for existing programs. Does that answer your question, Kate? But there won't be an adjustment beyond the way the formula is structured now. Go ahead, Beth Ann, and then Marissa.
Thank you, and thanks for that presentation. So just a little follow-up question to Kate's question. So if the pot's the same and you're trying to bring in new folks, or you may, that opportunity may arise, and I understand, Commissioner, how you were just answering that, but does it mean that for folks who continue to do what they did this year, will they get the same amount for next year? Or will it be slightly reduced, or will it need to just play out once everybody puts their data in?
Yeah, I mean, it'll depend on, you saw the formula. I think if nothing's changed in your program and you're in tier 3, 3 or 1. If you're in tier 1 and nothing's really changed in terms of enrollment and the kids you're serving, the number of CCFA, I don't think we would expect big changes for you.
Okay.
I think the other thing just to understand about the sort of level funding across the 2 years, because of the fact we didn't adjust the formula until November last year, we're now moving into the first 12-month period in the current formula. And so right now, 475 is sufficient to maintain the current formula, continue to allow new programs come in and do that based on our projections. But it doesn't build in expectations around inflation.
Yeah. And can I also ask a slightly different question? The salary benchmark goal, you're thinking about that for FY27, right? Is that how, that's what you just described?
Yes.
You're not trying to implement that in 26. It will be reviewed in 26. Okay.
Yes.
And we'll be doing it in partnership with our stakeholders and work on the credential. And so,
yes.
There'll be lots of conversation about how to set that, which makes sense in a private market.
Yeah, right. Great. Thank you very much.
My question was kind of along those lines too. So with the salary benchmark, that's sort of over the next year or so, that process, that's sort of the timeline for that process. It won't be in the next sort of 6 months before November.
No,
Sorry,
not
say that-
before November. No,
Okay.
yeah. I think what you saw Jocelyn say is that we were going to sort of foreshadow this by setting some expectations about the use of funds towards compensation for staff, but we don't have a salary scale right now, so we don't have anything, and that will be developed in partnership with all of you, and again, sort of carefully in the context of this private market, the budgeting and world that we're living in, and also the unique program types, right? So what it looks like in family childcare versus after school and out of school time, where you have some full-time staff and some part-time staff, and then in our center-based program. So it's going to have to be, it'll be complicated, and it'll have to be done in partnership.
Thanks, Commissioner. My other question was about the attestation. Just wanted to clarify, Jocelyn. So sort of the requirement is for the attestation alone. It's not in addition to signing a voucher agreement, or it's sort of those two things go hand in hand?
So the way we're thinking about interpreting that, it's the language says a willingness to, and the way we frame the question in the survey that we asked is like, if a child came to your program and they had a voucher agreement and you had a space, would you take that child and connect with your CC&R to get the voucher agreement that you need to accept this child? I think we're trying to make sure we don't create log jams for any part of our system. So that, but at the same time, I also understand, make sure that we document that willingness is in place. And, then we have the information for the CC&R that anybody who is in C3 is a program that a child could be placed in. It just might mean that there are instances where a voucher will be needed to be put in place as part of the enrollment process.
Great.
I mean, we're trying to find this right. So there's this legislative requirement that programs demonstrate their willingness to serve children with childcare financial assistance. The waiting list, we are not anticipating being able to reopen. So I think we're trying to find that line between, like, programs would be willing. You might have a parent who switches, right, from one program to another. It has childcare financial assistance and would like to participate. It'll now be a requirement for C3 eligibility. I think Jocelyn nailed the number exactly. We have a large number of programs that are already participating in CCFA. That's been growing over the years, thanks to rate increases and simplifying the system and lots of other things. And then you have a bunch of programs that have said through the survey that they would be willing. They just either live in a community maybe where there aren't as many vouchers available or haven't had a family come to them. And then we've had ones who are hard-nosed. So we will have to see what happens with those programs when this new statutory requirement gets put in place, and then is sort of, we're holding programs accountable to it. Kim, go ahead. And just anticipating, we're not going to create a mad rush on the CC&Rs of people asking for voucher agreements. And we thought about that carefully as we were trying to find the line between making sure people are attesting and not having them line up at the CC&R stores.
That is very much appreciated.
Without a hope of getting a voucher, right?
I think my concern is more about the folks who are saying that they're willing to accept an agreement. And it sort of sounds, Jocelyn, like that last example you gave is, okay, if they don't have an agreement, but a family comes to them and they are getting C3 funding and they've indicated a willingness to get an agreement, and that there's the potential for delay, I would think, if they're just sort of sitting there waiting for a kid to come before they reach out to us. I think it would go much smoother if there was some time frame. Yes, I'm willing to accept an agreement. I'll get an agreement in the next 60 days or whatever makes sense, than to be waiting for the child to show up. Because now if the R&R is backlogged at that point, it can cause a delay. And now the provider's either going without the kid attending and payment, and it just feels messy.
Yeah, we've
Yeah.
thought about that, and we're sort of trying to figure out like what would the right timeline be, and also I think wanting to be sensitive to your capacity and not wanting, you to get a rush of people all needing a voucher agreement tomorrow because that's what stands between them and C3 as well. So it feels like there's a balance, and this is probably something that we can keep working together to figure out exactly how to do it.
I like that you think we should kind of push people to be on some kind of timeline though. So we'll have to talk about that with the CCR&Rs. Like that is something we could certainly consider so that people are ready to go should that happen and there not be a delay. So we can talk about that.
And I'll just call out in the chat, Kim had the idea, like, could there be a pre-approval process as part of, sort of getting a voucher agreement? So there's a first step that's not too time consuming for anybody, but could get somebody on the pathway.
It's a good suggestion.
Mm-hmm.
Also, couldn't the payments be retroactive if you know somebody's eligible and has a voucher? No? I see you shaking.
If it takes a while for somebody to get a voucher agreement.
Yeah, but
so
if they have one and
they're eligible in November and they get it in December, and they could get the November and December payments.
Right.
I mean, we certainly have the authority to do that. I think that there are going to be some programs where the cash flow issue is a pretty powerful concern.
Yeah. Okay.
Again, we have like a very large proportion of the programs are already taking 60%, right? Are already taking child care financial assistance. And then of those who aren't, was it like 70% said they would be interested or willing? So I think we're going to be narrow. And then some programs might just drop out of C3 if they feel like that's a requirement. And so that'll be an interesting part of what evolves. So in this ever evolving program, still very much in an evolutionary phase. So I should just mention before we move off of this topic that there is a I don't know if you said this, Jocelyn, I might have missed it, but there is also a statutory requirement that we go out for public comment around the formula. Did you already talk about this?
I did in the timeline, but I think it's probably worth returning to it.
So what, as part of, either we hope next week's board meeting, but it may be in the fall, but there will be a public comment process for the C3 formula. So there'll be an opportunity more formally to engage in sort of some of the shifts that we're making in the formula. So you can look forward to that process coming soon.
I know you know this, but just want to reiterate kind of like the timelines, because people hear like half a sentence and then it's like, this lady told me I have to do this by next week. So like I know you're coming on the 9:30 call after the board meeting. So any way we can help with the like timeliney stuff and this how thoughtful you're doing this, I just want to make sure is communicated out, because I think and maybe
so we will come on there and talk about our slow walk into this, and everyone will call the R&Rs to try and get a voucher agreement in place starting tomorrow.
Great.
Gotcha. Right.
Okay.
Okay.
Appreciate that. Thanks.
Okay. Anything else on C3 for now? Thanks. That was very helpful. And also, I don't want to pass over the beginning part where people were recognizing the changes that we're proposing, Jocelyn, as things they've been hearing about and wanting to see. So also very much grounded in our work engaging 9:30 callers, but also with our own community. Eugenia is not here. She's enjoying a much deserved vacation. But a lot of the work Eugenia has done to engage with community partners and hear their feedback, and Jocelyn probably said this too, but even through the administrative review process. So still trying to really make changes to the program within the constraints that we have that are responsive to the feedback we're hearing from those participating. Okay, let's move on to strategic planning. So you all have met Emily Connor Simon yet, who's our Director of Special Projects. If not, you are about to have a treat. So we're very fortunate to have Emily working with us to help on a number. The definition of special is kind of broad, but the strategic plan is one of those. So as I mentioned in the beginning, we are legally required or statutorily required to have a 5-year strategic plan. The current one that we have been operating under concludes at the end of this calendar year. So we are working to take a look at what we've been accomplishing over the last 5 years of this strategic plan, and then start to build forward into the next strategic plan. As I mentioned in the beginning, I think, we collectively with all of you have made so much progress over the last 3 years, really coming out of COVID, lifting up the field, new investments. We have many things in motion at the agency. We have a lineup of regulation revisions, whether it's the RES ones that I talked about, or the childcare ones that we are actively working on right now. We also have IT modernization projects. We've been building a data and research team, changes to C3, implementing really the reforms of childcare financial assistance, which we knew would be a long-term journey, including our new contracts. So it is really our approach that we wanted to talk about today. So Emily is in the unique position of being new to the agency, but having a chance to look back a little bit and do some highlights of what we've accomplished from the last 5 years against the strategic plan, and then to share with all of you sort of our thinking about how we're going to move forward, which is really about building on the things that are happening. The momentum that's at the agency, the work from, say, the Economic Review Commission or other folks who are in the research and policy space, the 9:30 call, as I said, the Economic Review Commission, the Mass Budget Center. There are so many people who are Boston Foundation have been involved in early education, studying it, thinking about improvements, and our intention is to really stand on all of that. And then most recently, the Interagency Task Force on Childcare and Early Education, which also lays a really important foundation for how we are taking a whole of government approach to childcare and early education. So in the name of sort of efficiency and capitalizing on momentum, I think it's really our intention to sort of continue down the existing path. So with that, I know I steal all the headlines and then I turn it over to you, Emily, but please take the baton to walk through how we're thinking about approaching this.
Happily. Thank you, Commissioner. Hi, everyone. I've met many of you, and to those of you I haven't, look forward to connecting more during this conversation and beyond, and getting lots of your input and support on this process, because we can't do this without you. So Addison, could you go to the next slide? So as the Commissioner mentioned, we are legally required to create a 5-year strategic action plan for 2026 calendar year, not fiscal year, through 2030. And so we are currently in the process of sort of generating some ideas and visioning for the next 5 years of our work at EEC. What we realized is, before sort of looking forward, we really wanted to ground ourselves and our conversation with you all in our previous strategic action plan, the goals that we had set in 2020 for ourselves, and really the impressive progress that's been made since then. As the Commissioner mentioned, I am new to the EEC team, so I cannot personally take credit for any of these accomplishments, but it has been very exciting kind of looking through what the goals were and talking with everyone at EEC about the amazing things that have happened. So I want to spend a few minutes sort of walking you through what our goals were in 2020 and the progress that we've made in partnership with you all towards those goals, and then sort of shift to thinking about our 2026 to 2030 plan and how we are approaching that work. Next slide. So, and next slide again. So as the Commissioner mentioned, we released our previous current strategic plan in 2020. Funnily enough, in March 2020, which I think many of us will remember as being a challenging and trying time. But our current strategic action plan essentially was organized by 4 categories of our primary stakeholders and the folks that we are working to support: children and families, educators, programs, and systems. And so our current strategic action plan had essentially one big goal for each of those kind of audience groups. And the next few slides are going to sort of take us through what those goals were and a few examples of some of the work that we've accomplished over the last 5 years to help push us towards those goals. I will warn you, there's a lot of text on those slides, and I'm not going to read all of them, but I will read the goal and then give folks a little bit of time to sort of peruse what we've written. Also, the slides are not comprehensive. We did way too many things to include on each individual slide, but we hope that we chose enough representative examples to help you feel good about not only the work that EEC has done, but really the work that you have helped us do over the last few years. Next slide. So the first goal in our 2020-2025 strategic action plan really revolved around children, youth, and families. Our goal was that children would be on track for success in school and to reach their full potential, and that their families would also have kind of the support and access and opportunities to have their own economic development and support their children's development. So here you'll see a few examples of the work that EEC has really accomplished over the last 5 years to help push us towards this goal. And I just want to give folks a few seconds to take a look and celebrate and hopefully see yourselves represented in a lot of this work. And also, if there's something that you're thinking of that's not on here, that's also great. Again, didn't have space to fit everything, but really just wanted to acknowledge a lot of the progress that has been made towards the goals that we set in 2020. All right, Addison, can you move us to the next slide? So the next category, the next 2020 goal that we had set was really around educators and professionals and them feeling professionally prepared, supported, and adequately compensated. And I think, as many of you know, we've made a lot of strides in this space with our current development of our credentialing work, our career pathways work, and our partnerships with PDCs and community colleges, as well as you'll sort of see on the bottom, several specific pandemic-related response initiatives that we did to support educators and professionals through that really challenging. So again, just really exciting to see the progress that we've made even in the last 5 years towards this goal of supporting our staff. We can move to our next slide. The third 2020 goal in our strategic plan was really around program sustainability, stability, and quality. And again, just a sampling of the work that we've done over the last few years towards this goal. But you can see a pretty wide range of financial supports, as well as professional development, staffing capacity that we've really rolled out to support program stability, program quality towards this goal from 2020. Then our final sort of retrospective slide and our final goal from our previous strategic plan was really looking at systems and how our systems were effectively and efficiently utilizing public investments to support the people and programs in the field across the state. And I think here you'll see especially a lot of capacity improvements that we've made over the last few years. We have a new data analytic and research team. We have a new director of direct diversity, equity, and inclusion and belonging. We've done a lot of community engagement and conversations, including with you all, and sort of really kind of setting up the system of EEC to be able to do the work that we think is really important. So I hope you all feel seen in the work that you have done, as well as supported us to do over the last few years towards those goals. And I think the goal here is really just to frame how these goals from 2020 have really driven our work over the last few years. And as we look towards the next 5 years in our upcoming strategic plan, that's sort of the same mindset that we're really trying to use. We want to make sure that our work and our goals are really closely connected. So I'm going to shift us forward to talking a little bit about the next 5 years, our approach to planning for the next 5 years. Commissioner, I saw you come back on video. Is there anything you wanted to add? Okay. Nope.
You're doing great, Emily. Forge ahead.
Okay. So as we look ahead to our next 5-year strategic plan, there are a few things that we're really prioritizing in that process. I think one of them, as the commissioner said, we're really looking to continue and expand on the current work that we're doing. We're not looking to start from scratch. We know what we need to do. We know what works, and we want to continue moving that work forwards. Another really big piece of that is we are really trying to build this strategic plan around the input and feedback from families and providers and programs. I think you all are a great example of that, with the work we've been able to do with the advisory council, with other stakeholders to really understand how the policies and programs that we're doing are affecting the field and what the field would like to see. That input is really continuing to drive us forwards as we think about our priorities for the next 5 years. Similarly, we're really focusing on utilizing best practice research from the field. So the commissioner mentioned economic reports, other research projects that we've done, as well as that have been done kind of outside of EEC, that are really driving kind of what we know the system needs and what we should be focusing on. And then as we are doing a lot of IT modernization, as well as the wider range of work, we're really prioritizing user-centered design, and in everything that we're doing, thinking about how is this going to look and feel and be accessible to those who are going to actually be using it. And then lastly, we are really emphasizing using the data and metrics that we have and that we're continuing to collect and grow to really drive our improvements and measure our progress moving forwards. So we can go to the next slide. So as I mentioned, stakeholder engagement is a really core component of our thinking for this next strategic plan. We've engaged with a lot of stakeholders over the last few years, including you all, and we're really seeking to use that input to inform our next plan. So we have conversations like these with you all, with our workforce committee and our data advisory commission as well. As the commissioner mentioned, we also have the Interagency Early Education and Childcare Task Force, which started last year, included a lot of listening sessions with community members around priorities and challenges in the field. And right now, I can say as a member of that team, is also involving a lot of really exciting collaboration between different agencies in state government to think about moving all this work forwards. And so that is really driving the work that we're doing. And then we have a lot of regular stakeholder engagement opportunities. Shout out to the 9:30 call, as well as all of Eugenia's listening sessions and working groups and focus groups, where we've been really excited to gather so much information and input from our communities and our stakeholders over the last few years, and really see that and their perspectives as driving our priorities over the next 5 years. And then sort of lastly, in this sort of bucket, as we are revising our regulations right now, we are hosting public comment opportunities and having engagement with providers and community members. And so that is also going to continue to inform our strategic planning moving forwards. Let's go to the next slide. So as I mentioned, another big category of kind of input that is guiding our strategic planning work is research. So externally, you'll see a sampling on the slide of some of the kind of big research reports and projects that have come out over the last few years, whether they're around financing and economics, or thinking about family access, coordination, alignment. There's been a lot of really strong research coming out of the field around how states can do this work well. And so we're really using that as a foundation for the initiatives and priorities that we're thinking about for the next 5 years. In addition to the external research, as you'll see on the next slide, there's also a fair amount of internal research that we're doing. So Addison, could you change the slide? So as I mentioned earlier, we have a new EEC data team and a new EEC research and analytics team, and they are doing a lot of work really identifying key priority research questions and initiating our own projects into questions and challenges that are driving us. And so we are developing a really robust set of internal research to guide our work, as well as our KPI dashboard, which I'm sure many of you are familiar with, which is helping us really stay focused on data and use the data that we have, continue to build out our data infrastructure so that we're being really responsive to the field and to what's actually happening in those spaces. On the next slide, I will also talk about our IT modernization. So the commissioner mentioned this, but we are currently excited about these new systems that we're developing and that are hopefully going to start rolling out in the next year or so, including our CCFA family portal, our new educator portal, some improvements to our background check navigator system, as well as our learning management system. And so we're really excited about these new systems that are being developed, and they have all really been developed in collaboration with and with input from stakeholders. And so we're really excited for the input that you all have shared, that all of our other kind of community members have shared, that have really helped us develop these systems, which we hope will really meet stakeholder needs and generally just streamline the experience and support that folks are feeling from EEC as we move the work forwards. And so we're really excited about this as sort of a core component of our next 5 years and thinking about how our better IT systems are going to really support the work that we're doing and support the work that's happening in the field. Our final sort of input in this approach to our strategic planning for the next 5 years is our strategic objectives. So I'm sure as many of you know, over the last year or so, we developed these strategic objectives to really organize the work that we're doing at the agency. So family access, program quality, workforce supports, program stability, and agency infrastructure. And these are really helping us organize our thinking around the next 5 years and making sure that we're keeping all of our different stakeholders in mind and sort of parts of the system in mind. It is similar to kind of the structure of the last strategic plan, but a little bit different. And we're currently thinking that our strategic plan will essentially have a section on each of these strategic objectives with goals and priorities associated with each one, so that we make sure we're covering the kind of broad areas of work that we work on here at EEC, while also going to an important level of depth on each one. So those are our kind of primary inputs as we're thinking about our approach to strategic planning. To give you a sense of the timeline, this summer we're doing some additional stakeholder engagement, working on developing our metrics and working in collaboration with our board to really finalize and tweak kind of the pieces of the strategic plan. Our goal is to return to you all in the fall with a fuller draft of our strategic action plan so we can get your feedback on it, your input and supports, and then to bring this to our board in November, December for a vote. That is kind of where we are currently in the process. I would love to, I'll just open it up now, I guess, for questions, reflections, concerns. Kate.
So I want to take a second, because I don't think we do this often enough, to really compliment you guys on the extraordinary things you got done in the past plan and process and timeline that we've all been together working on this. Because, when I looked at those slides, and I didn't really need them to remind me of all the stuff you've gotten done, but there were some things I'd forgotten. But you have built extraordinary positive momentum across the EEC. You've become a much more data-driven organization, which is enormously helpful to the field. You're centered on those that you serve, and I have rarely seen a culture switch as dramatic as this. So I just want to say I'm actually excited that you're taking the approach on your strategy to be staying focused and not trying to do some epically new thing, because you're executing every day in a way that's incredibly meaningful to all of us. So kudos and thank you for staying the course. I do think the technology piece is a bear, and I think it's going to occupy a ton of time, but it is absolutely the only Achilles heel I can still find, other than the fact that we don't have enough money, to let all the children that need this in. But like good for you all. Like, you deserve a standing ovation for 4 years backwards, and look forward to the 4 years ahead.
Thank you so much, Kate, and then everything. And I'm like so happy for the EEC team, because I was like, we don't need to do like a big blue sky thing. Like, we just need to keep going. And they are so busy and executing, just like you said, every single day on the work that we're doing. So your comments and the comments in the chat are such an affirmation for the team and the direction that we've been going in. So I will say we are bringing in a new talent starting Monday to help us on executing on the IT changes. So we recognize that is our Achilles heel, and that we need a little extra PT going into that. And so we have someone who's going to help accelerate that work and make sure that we're doing it in a way that's user focused and also integrated across state government. So those were helpful comments too. I think my big questions for all of you, as you now know what our sort of continue the momentum and path is with this strategic action plan, sort of two quick questions. One is, I think it's our intention to think that this is like the EEC strategic plan, right? But that's what's in our measurable control. We don't have to take on the whole field, because we know the transformation that's needed in the field is in partnership, and there are a lot of other players who are going to help us fix what we need here, whether it's the folks who are involved in the interagency task force, or those of you moving the early childhood agenda, or other parts of the field. So it feels like this would be sort of like an EEC document, like what are we doing? And obviously much of that is done in partnership too. And then the second question is sort of what would you think should be our expectations around stakeholder engagement? We had all these listening sessions last summer. We have these policy groups. We have the early childhood agenda. We have the 9:30 call. Like, is it an expectation of listening sessions? Like, do we want to, I guess we could use a little help on like how narrow or wide would you all feel comfortable as we think about building out this strategic plan based on sort of the work at hand? So those are the two kind of things we're struggling with, like thinking about it in the EEC measurable control, and then what are the expectations and how should we meet those around stakeholder engagement and thinking about this? Michelle, go ahead.
I answer a completely different question than you asked. I mean, I am all for stakeholder engagement at its highest levels. Stakeholders can opt in and opt out as they have capacity for. And I think the strategic plan in particular, only being done every 5 years, is such a great opportunity to engage stakeholders. I messaged you in the chat, Emily, you're always welcome to a Massachusetts Head Start Association membership meeting to engage in conversation with Head Start programs. One thing I've been thinking as I've been seeing, to Kate's point, all of the work that we remember and that we forget over the past 5 years, and remembering very closely, as I'm sure many of you do, the strategic planning process we all went through in 2019 to develop the plan, and how much of it was shaken up just a few months later. About what are the opportunities, or what are the ways in which we can create opportunities within this process and within the actual strategic plan document to highlight all of the changes that have gone on in the field, for better and worse, over the last 5 years, because the last document, while still great directionally, it was a lifetime ago, right? And we've had a lot of changes in the field, for better and worse. I mean, I'm thinking about the explosion of outdoor preschool programs over the last 5 years. And I'm thinking about, the very increased needs for mental health and disability services that we've seen, and the directions that we've taken there, and everything in between. And the ways in which EEC's policies, as well as staff, have been able to be flexible within the last strategic plan, and the ways in which they will continue to be even more flexible in the next strategic plan to handle all of those various changes, and the ways in which, we've seen the skyrocketing rates of mental health increases. And here are the ways in which the 4, 5, 6 EEC programs and systems have supported that. And here's where we're going to continue. And what are the ways we can really highlight how different
Oh, did we just lose Michelle? Are you back?
Than it was last time we wrote this plan in 2019. And that's not the question. Yeah, did you lose me?
No, you're going in and
Did I
out
lose
a little
you?
bit. I think I got your two really good, important pieces of feedback. One is use the existing infrastructure. So go to the 9:30 call, go to the Head Start Association, go to the Boys and Girls Club meeting, the WISE. Let's use what you all already have in terms of meetings and convenings, the MADCA meeting or the MADCA board. So the existing structures where we can go and share this information and gather feedback, and then fill in the gaps for anything that we need that's additional. And then the second big part was that making sure that we'd have some statusing of the field as it is today. So those feel like really two good, very important pieces of feedback. Thank you, Michelle. Laura.
Thank you. There is also just tremendous progress that has been made. So I want to double down on that as well and in thinking about carrying forward, building on, and as you said, Commissioner, keep going. And I also love the function of using the fact that you did all of this data collection quite recently, some of it to continue using and mining that, I think is very practical and functional. In terms of, setting up a whole new open-ended listening session may or may not feel like some duplication of effort, but I do want to really build on, I think Kim just put a comment in the chat a minute ago that is exactly the one I wanted to make and build on, which is about feedback loops. So if not doing sort of the broad funnel of everyone come and share your ideas, which you've done a lot of to continue mining that, one of the places I think of continued strength or continued growth rather would be feedback loops. And this would be, it's a little bit different than open-ended feedback. It might be, okay, we heard all this feedback. Here's the approach we're considering. How will this work for you? So, almost a defined, I would call it a pre-implementation, implementation, and then post-implementation feedback, where there's some really targeted input with people who have been directly impacted by whatever the new policies are, but in an open-ended way that says, like, if we do it this way, what do you think will happen? Okay, we chose to do it that way. How did it feel? Okay, now we're really into it. How's it going? And I think that's particularly relevant around your goal of provider stability and sustainability. But there's also really great places where you've already seen and you're pivoting in these ways. So the tremendous family access changes, you're kind of living that process now of the ongoing implementation. So could you make that a standard and really deliberate way of continuing to assess the weight of implementation changes?
Well, I love that suggestion, and it kind of is like a little bit of relief too, because it is the way we've been doing our work, and also rather than like a big one-time pre-print feedback session, and then we're like, see you in 5. Instead, what we should be doing is putting this out as a living document with a built-in structure for that continued engagement and feedback. And that kind of relieves the pressure on the sort of front end while making sure that whether it's changes in the field or pandemics or other things, that there's ways for us to be adapting along the way. That's a great suggestion, Laura. Really.
And my only comment is to be really deliberate about it.
Yeah.
To say like, it takes a little of the pressure out of the balloon. If you say we're running this by you, okay, we still have to make some choices. You may not love them. Now we're going to come back and ask how it's going. And so that may not always be 300-person rooms. It might be more targeted to educators or systems in family childcare or providers of all types.
The user groups impacted, right?
Thank you. Yeah.
Oh, great. Thank you. That's really helpful, and I think will help us sort of set the stage here. Go ahead, Amy.
I'm raising my hand to tell Amy.
You're on mute, Amy.
Oh my God. Amy, I was going to echo a lot of those comments. And as we learned back in the early 2000s with Early Education for All, sometimes people don't want to tell the state what they think about the state. So how can we as advocates and partners help with sessions? Marissa, I'm thinking of a group map. Where we have found really interesting ideas is where people can, this group map tool is written, you can give you can give specific feedback, you can think about how you structure that. And I think that's part of that feedback loop. I was thinking of somehow like saying like you said this or we heard this and here's the result of that. So people can say like I remember that when we were writing our first bill, people said, I can't believe what I said is in a bill. Like people, I can't believe what I said is now impacted policy. So I agree with Laura, like making it explicit and almost clinical about it. And maybe as a companion piece, over the past 5 years, it might be an interesting way to note all of what happened during COVID, the changes that were made, how the field, like we talk about unfiltered advocacy, the early, today the MEF team talked a little bit about the early educator scholarship, the prioritization of people who have children in childcare, like all those policies that came from those on the ground, instantaneous, flexible learning opportunities. Because I was thinking like 5 years ago, we had a different commissioner, right? There's so many changes. So acknowledging the kind of the context and all the opportunities you have had to be out there listening to people. You have been on the road, right? Like, so I don't know if it's an appendix of like, here's all the times you came in the 9:30 call once a month, you have board meetings, you are out there. And so, acknowledging that, and maybe that's not part of the state plan, but that should be part of the like this is how we're collecting. Like to Laura's point, giving feedback does not mean just coming to a session and listening and giving feedback. So
Right. So there's a different way we can even express that input of how much
Exactly.
I personally, but also my team has been out
exactly.
talking to providers, visiting programs, hearing the
Yeah.
feedback, seeing what's happening on the ground, hearing the hard stories and the great stories too. So
Right.
That's great. And also noting your offer of help.
I can
Chris.
see Marissa laughing now because it's not me.
Commissioner, I just wanted to double click on something you said earlier in this meeting, or actually Emily, but I think you had introduced it, was that we're predicating this on a lot of the work that we're doing. And Laura, to your point, that point of feedback loops, that I think that's really inherent in, and it's very inherent in the way we're planning our sort of smaller working groups, really targeted discussions on work that we have to do. That's going to continue to be, I think, really critical as we make progress. Because I hear you saying there's sort of input on the strategy, but so much of how we've gotten to where we've gotten, and I think why we have this sort of we-ness sense to the progress we've made is because we're building, I think, trust in those opportunities for us to have really working dialogues around how a thing might work. And it might not be 100% perfect for every program type or every region of the state or whatever it is, but let's create the opportunity and let's make sure that people see themselves in the process. That's been really critical. She's not here, but I think Eugenia would be saying the same thing. It's so central to the work that she does. And I think she really takes that part of her job very, very seriously and is a voice at the agency to make sure that as we take the feedback in, let's make sure we're putting up a mirror so folks can see themselves in it, in the process, even if the outcome isn't necessarily, Amy, the words they wrote on the page, get in the bill or whatever that is. They know that they were sort of in the Play-Doh making process, Play-Doh, building the tower, building the version of it. And that's going to continue to be really, really critical. This report comes out, we're going to sort of keep our heads down, keep the work going. But those sessions are, Eugenia is always thinking about new ways to sort of create opportunities to bring people in, like you said, really clinically on specific tasks or targets or projects we might have. So just want to call out, that's sort of all that feedback is built into the way we're starting to think about this. And it's going to be built into how we work on each one of the things that you'll see in that report together.
Yeah, just for the record, Eugenia is the only person that we need to have like a big meeting about what we're going to do while she's on vacation. Not me, not Chris, not Jocelyn, but Eugenia going on vacation. We all have to sit down and figure out how we're going to manage with her. All right, Kim, you get the last word here.
Well, thank you. I am thrilled with the way the conversation has gone and the embrace of the we-ness. I like that. I'm going to use that term today at least 3 times. That's my plan, so that it'll be part of my lexicon. I would say adding to the we-ness and others that need, I think, the intersection for your next 5-year plan, or I should say our next 5-year plan, also needs to include the task force and the report that was developed that predated the task force that is the best thinking about where we wanted to take our sector, and so much input was in there. And now we need kind of that next level group to be working with the department and, you know, the field to get to those next levels, because you won't be able to do all of this work at this next level of success without those partners. And I know you know that, but I think there's a way to concretely intersect the next strategic plan with all of that work.
The special thing about Emily is that Emily, in part of her special hat, the other hat that's special that she wears, she's one of our key representatives in the work of the task force. So she's working really closely with the project management team, really centering and making sure that the goals we're sort of contemplating in draft form right now at the agency are aligned to and informed by not just the recommendations from the task force, but the 17 listening sessions we had, the hours we sat together talking about this, the research that she highlighted. It's a great point, Kim, and one that we all agreed with from the jump. We've got this great foundation to start from here that there's no wheels to reinvent.
Great. Well, we'll make sure that at our next quarterly meetings, we'll have the task force team come back and talk about what's happening in there. Okay, well, thank you all so much. That was incredibly helpful. We're grateful for your comments on C3, your questions on the budget. Make sure we're being as clear as possible, and especially in this one, as we all engage in this going forward. Really grateful for it, and apologies for holding you a little bit late, and enjoy the heat because it's not lasting. All right.